A few years ago, a patient of mine, I'll call her Margaret, because that's not her real name, came into my office holding a bottle of powder she'd bought online. It cost her $98. The label promised that if she stirred 1 scoop into her water every morning, it would activate her collagen and eliminate her wrinkles within 30 days. Margaret was 67. She was sharp, she was skeptical by nature, and she still bought the bottle. Why? Because she loves her grandchildren, she wants to feel good in her own skin, and somebody who sounded very confident told her this was the answer. I want to tell you what I told her, and I want to tell you the truth, because you deserve the truth, not a sales pitch dressed up in a lab coat. My name is Dr. Your Name, and I've spent my career helping patients understand what's actually happening inside their bodies, not what a marketing department wants them to believe is happening. Today, I want to talk with you about something that touches almost everyone in this room. What really happens to our skin as we get older, why it happens, and what the actual evidence says we can do about it. This matters because aging skin isn't just a cosmetic issue. It's connected to how our whole body changes over time. And understanding it honestly is the first step to caring for yourself wisely, instead of chasing promises that were never true to begin with. 2. Introduction to the topic. So let's define our terms simply, because doctors love jargon, and I'd rather you actually understand this than be impressed by it. Collagen is a protein. Think of it as one of the main building blocks, like the steel rebar inside concrete, that gives your skin its structure, firmness, and bounce. Your body makes it naturally in cells called fibroblasts, which live in the deeper layer of your skin called the dermis. Elastin is collagen's partner protein. If collagen is the rebar, elastin is the rubber band. It lets your skin stretch and then spring back into place. As we age, 2 things happen. Our fibroblasts produce less collagen, and the collagen we do have starts to break down faster than it's replaced. The result is skin that's thinner, less firm, and slower to bounce back, which is what we see as wrinkles, sagging, and that papery texture some people notice in their 70s and 80s. Why should you care about the mechanism, not just the outcome? Because once you understand what's actually driving the change, you can tell the difference between something that could genuinely help and something that's just a good story on a label. Here's what's really going on, and I'll keep the science plain. Collagen production declines with age. Research consistently shows that collagen synthesis slows measurably starting in our 30s, and the decline accelerates after menopause in women due to the drop in estrogen, which directly supports collagen-producing cells. By the time we're past 60, many people have lost a significant percentage of the collagen density they had in their 20s. 2 forces attack collagen daily: oxidative stress and UV radiation. Think of your skin cells like a house exposed to weather. Every day, your body deals with ordinary metabolic byproducts called free radicals, unstable molecules that can damage cells, including collagen fibers, the way rust slowly damages metal. This is oxidative stress. Your body has natural defenses, antioxidants, to manage this. But as we age, the balance tips and damage accumulates faster than repair. Then there's the sun. Ultraviolet light penetrates the dermis and directly triggers enzymes called matrix metalloproteinases, MMPs, that break down collagen. This is called photoaging, and it is, by a wide margin, the single biggest external driver of visible skin aging. Far more than diet, more than any supplement, more than almost anything else we can control. Smoking. It constricts blood vessels in the skin, reducing oxygen and nutrient delivery, and directly damages collagen and elastin. Chronic high blood sugar. Through a process called glycation, excess sugar molecules bind to collagen fibers and make them stiff and brittle, like a rubber band left in the sun until it cracks. Sleep and stress. Poor sleep raises cortisol, which impairs skin repair processes that mostly happen overnight. Genetics. Some of this is simply written into your family's biology, and no product changes that. None of this is exotic. It's biology doing what biology does. And that's actually good news because it means the things that genuinely help are things we can explain, measure, and trust. Skin aging itself isn't a disease, so I won't call these symptoms in the way I would for an illness. But there are changes worth noticing, and a few that deserve a doctor's attention rather than a skincare aisle. Expected, normal changes with age, fine lines, especially around the eyes and mouth, gradual loss of firmness and volume, thinner skin that bruises more easily, age spots, sun-related pigmentation, slower wound healing changes that should prompt a visit to a doctor or dermatologist, not a supplement aisle, a new mole or spot that changes shape, color, or size, a sore that doesn't heal within a few weeks, sudden, widespread skin thinning or bruising, which can sometimes signal a medication issue or an underlying condition, persistent itching, redness, or scaling in one area. Skin changes accompanied by unexplained weight change or fatigue. I want to be clear, I'm not diagnosing anyone in this room today. But if you notice any of the last group, please see a professional. Normal aging is gradual and symmetric. Concerning changes are often sudden, unusual, or localized to one spot. 5. Diagnosis and medical evaluation. For most people, diagnosing skin aging isn't really diagnosis in the traditional sense. It's assessment. A dermatologist will typically take a history, sun exposure over your lifetime, smoking history, medications, family history. Do a visual skin exam, sometimes using a magnifying dermatoscope to look closely at texture, pigmentation, and any suspicious spots. Assess skin type and sun damage patterns, often using a simple visual scale. Rule out other causes if your skin changes seem unusual. Checking thyroid function, nutritional status, or medication side effects. Certain blood pressure medications and steroids, for instance, can thin skin. There's no blood test that tells you your collagen level, despite what some marketing suggests. Collagen density is assessed visually and sometimes with specialized imaging in research or specialist settings, not something you'll get a number for at a routine visit, and not something any water additive will change in a way you could measure. 6. Treatment and management. What the evidence actually supports. This is the heart of what I want to share with you, because it's where good information and marketing hype most often collide. What has genuine evidence behind it? Sunscreen, daily, every day. This is, without exaggeration, the single most evidence-backed anti-aging intervention that exists. Broad-spectrum SPF 30 or higher, applied daily, has been shown in long-term studies to measurably slow visible skin aging compared to irregular use. If you take away only one thing from this entire speech, take this. Topical retinoids, like prescription tretinoin or over-the-counter retinol at lower strength, are the most well-studied topical treatment for improving fine lines, texture, and collagen production. They work by directly signaling skin cells to increase collagen turnover. They require patience, usually 3 to 6 months, and can cause irritation, so starting low and slow, ideally with a dermatologist's guidance, matters. Vitamin C serums, applied topically, have reasonable evidence for supporting collagen synthesis and providing antioxidant protection against UV damage, though the effect is modest and formulation quality varies widely. Oral collagen supplements, since this is often what's being sold, deserve an honest answer. Some clinical trials show modest improvements in skin elasticity and hydration after consistent use over 8 to 12 weeks, not overnight. The effect sizes are real but small, and the research is still developing. No study shows a water additive that produces dramatic wrinkle elimination. If you choose to try a collagen supplement, think of it as a small, possible assist, not a transformation. Procedures with solid evidence when performed by qualified professionals include laser resurfacing, microneedling, and certain injectable treatments. These are medical decisions to discuss individually with a dermatologist, weighing your health history, budget, and goals. What doesn't hold up? There is no ingredient you stir into a glass of water that activates collagen production in a way that meaningfully changes your skin. Collagen is a protein built through a biological process inside your cells. It isn't switched on by a substance in a beverage. Claims using words like activate, eliminate, or guaranteed results in days are marketing language, not medical language. Every treatment decision, especially prescription retinoids, procedures, or supplements if you're on other medications, should be personalized with your own physician or dermatologist who knows your full health picture. 7. Prevention and healthy habits. Here is what I actually recommend to my patients and what I do myself. Sunscreen every single morning, rain or shine, even on cloudy days, even if you're mostly indoors. UV passes through windows. Don't smoke. And if you do, know that stopping at any age slows further collagen damage. Eat a genuinely balanced diet, one rich in protein, which supplies the building blocks for collagen, vitamin C, citrus, peppers, leafy greens, needed for collagen synthesis itself, and omega-3 fats, which support the skin's barrier. Stay hydrated. Plain water because it supports overall organ and skin function. But understand hydration keeps skin looking plump. It doesn't rebuild collagen structure by itself. Sleep 7 to 8 hours when you can. This is genuinely when skin repair processes are most active. Manage blood sugar, especially if you have or are at risk for diabetes, since it directly affects collagen quality through that glycation process I mentioned. Gentle skincare. Harsh scrubbing damages the skin barrier. A simple, consistent routine outperforms an aggressive one. None of this is glamorous. It's not a secret ingredient. It's the unglamorous, well-supported truth. 8. Common myths and misconceptions. Let's clear a few things up directly, with compassion, because I know how appealing these claims can be. Myth. There's one ingredient you add to water that eliminates wrinkles. Truth. No single additive activates collagen production in a way that produces the dramatic results these ads describe. If it sounds like a magic switch, it's marketing, not medicine. Myth. Expensive means effective. Truth. Price has no reliable relationship with efficacy. Some of the best studied ingredients, like plain retinol, are inexpensive and widely available. Myth. Results should show in days. Truth. Skin cell turnover and collagen remodeling take weeks to months. Anything promising overnight transformation is not describing real biology. Myth. If a doctor's photo or voice endorses it, it must be legitimate. Truth. Please be cautious of advertisements using a doctor persona. Genuine, real, named clinicians rarely endorse specific commercial products this way, and it's worth checking credentials before trusting a claim just because someone in a white coat is making it. Myth. Natural aging is a problem to be fixed. Truth. Aging skin is normal, healthy human biology, not a disorder. Caring for your skin is worthwhile. Treating aging itself as a failure isn't fair to yourself. 9. Doctor's advice. If Margaret were sitting in this room right now, here is what I'd want her, and you, to hear directly from me. You do not need to fear your own aging skin. You do not need to spend $98 on a jar of hope. What you need is much simpler and much more within your reach. Consistent sun protection, a handful of ingredients with real evidence behind them, honest conversations with your own doctor about what's right for your body, and patience with a process that was never going to happen overnight for anyone, no matter what the label says. Taking responsibility for your health doesn't mean chasing every trend. It means asking good questions, including of me, your doctor, and trusting evidence over urgency. You are allowed to want to feel good in your skin. You are also allowed to say no to something that promises too much, too fast, for too much money. So let me leave you with this. Your skin at 60, 70, 80 tells the story of every sunrise you've watched, every laugh that etched a line by your eyes, every year you've actually lived. Caring for it well doesn't mean erasing that story. It means supporting your body with the same evidence-based respect you'd want applied to your heart, your bones, or any other part of you. There is no secret. There is no single scoop in a glass of water. There is sunscreen. There is patience. There is good nutrition. And there is you, showing up for your own health, one honest, unglamorous day at a time. That is more than enough. That has always been enough. Thank you.